wrist fracture.
Oh,
yeah. I want to entitle this segment FOOSH. What the FOOSH? All right. And the reason is, I know it sounds bad. I'm always like a little.
you're just on the edge. You're just on the edge.
No. So here I am reviewing notes for Blue Cross, and I see in there patient FOOSH. I go, what the heck? Found on outstretched hands. So what happens when you fall and you put your hands out? You fracture your wrist, okay? And what happens is the most common place to fracture is what are called your carpal bones, all right? So the tendency is to hit right here, and the scaphoid is one of the bigger bones that takes it. The other area is the Colles area, which is the top of these bones right here, okay? So you have your carpal bones right here, that's what this is, and then you have the top of the bones, which is right here. So you can break either when you fall, okay? And it can take anywhere from 6 weeks to 3 months for these bones to heal. And if they're not casted correctly or fixed, you can get what's called a dinner fork deformity. And I know you've seen it. Your wrist should be straight out, okay? But if it sort of has this little lump, it means that this didn't heal properly and it's made this little dinner fork deformity. And that's what you don't want, because you don't function quite as well. So there really isn't an eval. I mean, you're going to know if you fractured your wrist. It's going to hurt, it's going to look weird, and then you need to go to the ER and get it either set or you can get it surgically repaired. The answer is, right now, surgical repair is considered better. But who knows, in 3 months it may go the other direction.
And it depends on the doctor too, right? Their preference?
Yes, but in the literature it's pretty clear that surgery is a little bit better. It more depends on the kind of fracture. If it's decimated, it may not heal well, or it may not be something that surgically is easy to fix. So again, it depends on your doctor, it depends on your fracture. But Dana's going to give you a few things related to if you had it surgically repaired, if you had it put in a cast. Both of these, the things she's going to tell you apply. So you can do something.
Yeah, just when you're in the cast, like often people think, oh, I'm just in my cast, I just have to wait it out. But there's a few things you can do to help yourself. One really is to work on the swelling, because when you're in the cast and your arm's down, you don't get good circulation at all. Your fingers can get swollen, the cast can feel tight. So you want to spend a lot of time elevating, and to elevate, you really need to have your hand above your heart. So if you're sitting, and just putting your arm on your lap, that's not enough. You really need to be down and get your arm high. So, Carol had a fracture and she would teach with her arm like up on her head and all that, but it really helped. You don't have to be quite so dramatic, but if you're sitting, try to prop your arm up or lie down and get your arm above your heart.
You can just literally hold your hand like this.
Yes. And so it really will help. Get the swelling out of your hand, and your body heals better when it's not full of that extra fluid too. Monitor your cast. As your swelling goes down, your cast might feel a little bit loose. If that's the case, actually go back to your doctor. You might need to actually have it recasted so it fits better. So be aware of those things. The cast shouldn't be slipping around on you. Then when you're in the cast, you want to move your digits. So part of your fingers will be out of the cast. You actually want to keep those moving. You keep the tendons gliding, you keep things from getting stiff down your arm. The finger tendons go the whole way down your arm. You keep those moving, you keep these digits in the joints out of the cast from losing mobility.
And how often?
I would do it multiple times a day.
Like every hour isn't too much.
Yeah, you can just kind of wiggle around. Make sure you're doing it at least 5-6 times a day. And it doesn't have to be anything fancy, just move them. And then also move your shoulder. Make sure you're not protecting and guarding yourself. So move your arm up and down, different planes of motion. Just make sure you're not really guarding and protecting that area. So when you come out of your cast, you've got a lot of functioning joints. That will help your recovery so much more. Bend and straighten your elbow. And then when you're out of the cast, make sure that you see a physical therapist or occupational therapist to regain your mobility and strength. Not all doctors will necessarily refer you to one, so be proactive and make sure that you are seeing a therapist to help you get your function back in your hand. You have anything else to add?
No, I love that.
All right, go physical therapist, go occupational therapist, go see them, and those are your exercises for aging well.